Hello, my name is Noel Bell, and this is a podcast on perfectionism and shame. I was going to say perfectionism and loss. To help me on the way will be Dr. Aleta Edwards, all the way from Tampa in Florida, who's written the book Fear of the Abyss, Healing the Wounds of Shame and Perfectionism. And I'm delighted to have Aleta down the line at the moment. I always get confused when we're in different time zones, Aleta. So it's good afternoon from here, but it's morning still there, I think.
Yes. So good afternoon to you.
And I have to say, we have some very, as you'd say, nice fall sunshine in London in the autumn. It's very Floridian. Is that how I'd say? Very sunshine like today. So it sort of half feels like we're in Florida. So thanks for agreeing to have the chat, Aleta. You studied at Chicago School of Professional Psychology, graduating in 1992. Do you want to just give us a brief outline of your approach, modality, your way of working?
Yes. The program I went through was specifically for clinical psychology, and people did have different orientations. And even at the beginning, I knew that my orientation was insight oriented. You could also say psychoanalytic, which is not the same as formally being a psychoanalyst. It
Yep.
means psychoanalytic orientation or psychodynamic, and as some people would say, holistic. So, what it really means is that if a person comes to me and says, I've not been able to sleep for 6 months, can you help me? What would interest me in helping the person would be what happened 6 months ago and what kind of inner issue did it trigger. I wouldn't just address the symptom and say, go to a doctor for
Yep.
a drug, or, you know, here's try some deep breathing. I may suggest a couple coping things, but my real emphasis is that healing is different from coping. And I would try to help the person discover the reason. Because to my thinking, when somebody gets a symptom, it's an alert that something is going on deep inside that we don't know, and we need someone who's not us to gently help us find out what that is.
For sure. And when did your actual clinical work start? Was that through the training, or was it post training and post qualification?
Well, I say that I have almost 30 years of practice with, and uh, it's not like I want to make this longer, but that's when I was on my own. It's like 28 years. But the truth is, we do two 9-month placements in therapy diagnostics, always working with people. And then we do what we call an internship. I don't know, maybe you call it a residency or whatever, but an
Yeah,
internship,
yeah, certainly, yeah,
which is, it's a full-time year.
yeah.
Then we get the doctorate, we do the dissertation, we've taken all the coursework, and then we do a postdoc, which did seem a bit anticlimactic because you've got your doctorate in psychology, but you may not call yourself a psychologist until you're licensed here.
Sure.
You may not. So you're in Never Never Land. So you do a postdoc and you're a doctor, but not a psychologist. And that's a year. Truthfully, when it's all finished, you're glad you did it. I had a wonderful one with somebody who was also very psychoanalytic and psychodynamic, and I've worked with all types of people, different cultural, ethnic groups. I speak Spanish, so I was able to work with Spanish speakers, which I loved. And it really was, it's a wonderful thing. It was great. So all of this really helped. It helped me see that while we all have different icing on the cake and different ways we communicate, maybe different things sound differently to us, something might offend you and I'll think it's funny, or I'll, vice versa.
Yep.
At the core, I'm finding and have found that we're pretty much the same with our dynamics.
Yeah, sure, sure. And in terms of practicing, do you, with that background, are you essentially a blank screen practitioner? Are you the archetypal analyst that is non-relational, or are you relational?
No, I call myself a transparent screen. I think really, I think I kind of wear my heart on my sleeve. And I think I have to say, my client, I don't know if you say clients or patients.
Oh, clients, yeah.
My clients, they're terrific. They're all terrific people. But I think they felt comfortable. I don't care about the purity of the material. I care about people resolving their issues and getting relief. So I jump right in. I wouldn't be a good blank screen. I'm too people oriented. And I think the relationship matters a lot.
Yeah, and I think we're all probably, well, a lot of us are sort of influenced from the 50s, the sort of democratic trust of humanism, Rogerianism. And funny enough, I came across something, I was just reading Jordan Peterson's book, and he quotes Rogers saying that Rogers thought it was a precondition uh, that good clinical outcomes was required for the client to want it, to want to get better.
You know, I think it does. I mean, the people who come are in distress and they do want to get better. But I think we're such complex creatures, humans, that sometimes what we want so very badly involves something that we don't want that maybe we're not aware of.
Yeah.
So I would say if somebody mostly wants the help, that would be a prerequisite. Um, at least for me, at least for me. But I think I don't know that anybody wants it completely. What I find, and I don't blame them, but what they want is take this anxiety away, take these nightmares away. I just want to be happy. Can you just give me that? And I say, oh, if I had a magic wand, believe me, I'd use it right now for you, but it
Yeah,
doesn't work that way. And you'll see how lovely the process is when you get going.
absolutely. Yeah.
You know, but I think except for like weird types of people who become therapists like us, most people do not start out thinking I want to know about myself. I want to be more self-aware. So, I call it the hard sell. It's like the little joke with my clients. It's like, yes, you're very anxious, and the things we repress are not the happy things, but to be more aware is lovely, even if you uncover some painful things, because you won't have to symbolize them and suffer every day. You won't
Yeah.
need to do that. So I would say people want to do it, but it takes a lot of trust. I think the way people were in the old days, the blank screen, I went to an analyst way back when, and I didn't want to use the couch. He was a lovely older man. But yeah, I was in my 30s. He was older now. I wouldn't think he's so
Mm.
old. But I sat in the chair and he talked. You know, I just said, I'm not going to do it if I have to lie there and just keep talking. This is a relationship.
Yeah.
And he said, he was towards the end of his career. He called me Mrs. Edwards. And he said, hey, Mrs. Edwards, you make a good case, you know. And, and it, you know, I think that had to evolve. It had to evolve. It's really not the purity of the material. We exist with other people, right? We interact.
I would agree with you, but then of course classical Freudians would say that forcing the transference gets ultimately to useful unconscious material.
I think, you know, I look at it, I know they would say that. And I love Freud and his contributions in starting the whole thing. I think there are people who have gone beyond, but he started it and he gets credit.
Yeah.
I think that everyone affects us. And I think all of us have times we feel vulnerable and, or if you want to say regressed instead of vulnerable. And I think all of our interactions with people to a degree get taken in. Now, when you go to someone for help and you're telling very personal, vulnerable things, if the love, because I do think therapy's a certain type of love, I do, a special type of caring. If you internalize that, that's not going to hurt you.
Yep.
That's going to help. And if that blends with your conscious and unconscious experience of maybe a parent that was not so good, that's a win-win-win.
Yeah, for sure. Yeah.
It really is, because in with a good experience with you, and I've seen this over and over, I'm sure you have too, that person will come to say, oh, you know, well, my mother had it rough. You know, that's why she was like this. But I'm really getting along with her better now, and she seems softer. It's because you're in there.
Yeah.
And we don't do this for credit. We do this for people to get relief, right? So
Yeah.
I, uh,
So that's really fascinating. It's we could do a whole separate podcast on ways of working, because I just I always think, like you said, it's very, the commonalities are much more than the differences. Sometimes, um, you know, therapists from different modalities, it's almost like the difference between ways of working, it can be highlighted when really we're all kind of doing the same thing. It's just maybe the roads are all leading to Rome, but there's just maybe slightly different road system to get there.
yeah.
So, Aleta, your book then, so Fear of the Abyss, Healing the Wounds of Shame and Perfectionism. So, I mean, I read, God, years ago, Bradshaw, Homecoming, and all his books, and talking about toxic shame from how, uh, you know, children in alcoholic backgrounds, for instance, or where there was abuse or violence, um, sort of interjected a sense of that it was something they did wrong, and he was sort of putting over, at least this is the way I read him, that you know, where guilt can be useful sometimes for affiliation and for helping us in the socialization process, the really toxic part is shame, where people kind of assume guilt when it's not their fault for something that happened. So, what's your sense of shame?
My sense of shame is more, it's not guilt. The reason I say healing the wounds of shame and perfectionism is it's what a lot of people would call poor self-esteem. What I'm calling is a really horrible feeling about oneself on the inside, a really bad feeling. So to me, there are people, in fact, someone did say to me once, he said, I don't identify with shame. I don't have that much self hatred.
Yeah.
And you know, bless his heart, you know, he did better. This was a long time ago, but it's, you know, to me, self esteem is very vague. It's really a feeling that you are never good enough. So people make jokes about being a perfectionist, which is not doing a good job. Doing a good job is separate. That's not what I'm talking about. But a person where one little mistake makes you a terrible person and you're just always getting out of breath to tread water, you don't go anywhere. So people make jokes about perfectionism. Oh, I'm such a perfectionist. I've seen people get ready planning a wedding. It should be such a joyful time. And they're miserable and they're fighting. And they lost track that it's the relationship that matters, not how the wedding comes off,
Yeah.
really. Now, I'm not saying it doesn't matter, but not as much.
Yeah.
So for me, a lot of cases, and I've seen this, of anxiety disorders, panic disorders, depression, have at the root what I call a constellation. So shame to me means that I, I called it the PCO personality, perfectionism, control issues, and shame. But there are some other traits and they interlock. So people come and they say, I have this problem, this problem, this problem. And I'm like, you just have one problem. You're hurting, and let's see what we can do. It's just one. And I think, you know, it's just like with physical health. You can have something wrong and have a whole bunch of symptoms. It's the same. And what I think what really got me interested in this is that these are very nice people. They're so caring, they're conscientious, they're wonderful folks, and they're mean to themselves. And they have other traits too. They have other traits too. But what the perfectionism does is keep warding off what I call the abyss, which is an inner feeling or self image that they're trying so desperately to not be aware of. And it doesn't work. I've had a lot of clients, oh no, you wouldn't believe all the degrees they had. You maybe you've had them too. You know, they'll tell you, I have a master's, you know, in math and engineering, you know, blah, blah, blah. That's not going to get you better.
Or even the more material or career progression and success, the more that abyss is more pronounced, almost the sense of being with that abyss. Yeah.
Yeah, because it doesn't work. It doesn't work. So I think one difference in approach would be if you're insight oriented. For example, if somebody said, you know, I wash my hands 50 times a day, the goal would not be to get them to go to 40 times a day or 30 times a day. My question would be, what agony is this human being in front of me suffering?
Yeah.
Where he feels that he has to do that. And this is what I try to do, is connect with people with what's hurting. A lot of people feel that their dignity has been destroyed by the way they've been treated. And I guess you would call this the humanistic or existential
Yeah.
side of me, which is very much there.
Yeah.
But I try to tell them that whatever their belief, that dignity is God given or universe given, that people can only destroy their own with cruelty, but in the same, but theirs is intact.
Yeah. Because just as you were speaking there, I mean, obviously we're one therapist to another, but if a psychiatrist was listening and might be treating anxiety disorders, they will have more of an eye for the neurobiology of how the brain works. And
Right.
so, do you have any kind of eye on the actual mechanics of how the brain works and how you might be thinking of how to treat anxiety? Or are you coming from it more from, lifting the bonnet up in the engine, and you're kind of getting in there to sort of see what's underneath, what's impacting on someone's psyche?
The second one,
Hmm.
um, I think brain research is good. I mean, you can have two children in a home with problems, and one will become a very anxious, depressed, perfectionist, and low self-esteem, and the other person might become a criminal or a drug addict. Why does one? I mean, I think that what I call the PCS, the perfectionism, control, and shame people are the true survivors.
Yeah,
What what I think is that our genetics interact with our environment. And I think sometimes with the brain studies, if you look at someone who's extreme, like with OCD, and well, they've got something defective and let's try to fix this. If you knew, I don't mean you, but if we knew what that person went through, the road to that is excruciating. It didn't come from
yeah,
nowhere. It is a desperate reaction where another person might have been suicidal or homicidal. These are people that developed a way. Let's keep doing little things to give me control and order in some little part of the world. So I think addressing that other hurt with or without the brain interventions
yeah,
is important because we are we are human beings and we grow. And
yeah,
I don't think everyone's anxiety is the same either. There's an example, if I can do a real fast example, if that's okay,
sure,
in
yeah,
where two people got laid off from their jobs, and one person was really anxious because he didn't have the resources or connections to get another. He was worried about paying his rent. He was worried about survival and was extremely anxious. And the other person, the PCS, perfectionism, control, and shame, was I feel stupid, I was laid off.
yeah,
Those are not the same. So I think if a system does want to look at the brain, I think you really need to look at not just the label, but who is suffering these symptoms. Because we're the host.
yeah,
I think the host is, and the type of person is more important than the label. So, there are books, how to treat depression, how to treat anxiety. These two guys are not the same animal.
yeah,
They're just like other people with a breakup. Someone is grieving and they miss their loved one, and they feel horrible. There's a big hole in their lives. And then you have the other person who's, oh, I'm mortified that I was rejected. These are not the same.
yeah,
They're totally different. So I think maybe with anything, maybe it's humans all think we have, the bigger part of the answer, but I am partial to the issues. I don't mind when somebody really needs medication. I don't stand in the way if they want to see a psychiatrist. But I have had people in the past where a psychiatrist sends a note and says they need relaxation, they need this or that. And if you really listen to people with your knowledge of dynamics and you listen with your heart, they will tell you how they got this and what's wrong and what needs repair, and they will not have those symptoms anymore.
Mm.
You never address the symptoms, you addressed underneath.
Yep.
And I think we all need love and respect and understanding. And so I guess, again, I don't know the climate in Europe so much, but I know here a lot of physicians, psychiatrists or other, who really can get so wrapped up in symptoms that they are not so aware or care about what's underneath. And I think we have to,
Well,
because
but if you're in public health administration, I mean the NHS in England, for instance,
okay,
psychiatrists don't have the time to
yeah,
sit and do the therapeutic work.
right, that,
So, yeah, we are picking up where um, maybe a diagnosis, and then if a pharmacological kind of prescription has been advocated, then we kind of work with that. But if I see someone not having come from the psychiatric diagnosis route, then um, I'm probably, yeah, like you said, I'm not going to be trying sort of pathologize or think of them as a label. It's a human being in front of me.
right. No, you really raise a good point. I mean, I'm one of those people. I think everybody deserves health care that's first rate, because we don't have that here. We have the opposite. You just hope and pray you don't get sick. But
Well, yeah, but actually, I mean, this is a little bit of a tangent, but it's just come up in passing. But I mean, the West, I mean, Western Europe and North America, if you think of the brain drain from parts of the world who most need healthcare professionals, like West Africa, it's shocking the brain drain where people are being enticed to take up jobs in the NHS in England and to North America, where you know places like Nigeria. I mean, I saw the stats. I don't have them in front of me, but for a population of, for a big population, there's just a psychiatrist here and there.
right, I know, and the practical problems really are sad. It, it- you know, I don't know how to solve. I mean, I know some things I would do here, but of course I'm not in charge.
Yeah.
But uh, no, people don't have enough. But I know that I've worked with people from a lot of different places. When I was doing community psychology, you know, before the private practice, and they'll go through so much, and then at the end, whether they're victims of torture, victims of poverty, disease, they'll tell you at the end, I felt like I was nothing.
Mm.
I still feel like I'm nothing. And I think it's not just the parents. There are people that had good parents and pretty good homes that have these issues, but society does it in countries where they suffer so badly. But then I look at even here how competitive it is. I've seen a lot of teachers as clients, and they say parents come to them. They have standardized testing the children every few years, and they say, "What kind of scores do your kids get?"
Yeah.
So I'll know if I want my kid in your class or not. Well, not everybody can be in the 90th percentile.
Yeah.
Not everyone can be, and who cares?
Yeah.
I mean, you know,
Yeah.
I and character and wisdom are not emphasized enough, and these numbers on tests are supposed to be the thing. So I think self-esteem takes a lot of hits in school, a lot. I've seen a lot of people that I would have to call gifted, and they were so anxious and depressed as children, they couldn't do well in school. So they were labeled as special needs,
Mm.
put in special ed, and they, the only thing special about them is that they're so smart.
Yeah, and they probably froze when it came to the traditional examination time. So the clients, Aleta, that you see typically, and I suppose we are talking typically,
Mhm.
will they present with perfectionism and shame as issues, or are they things that just emerge?
They don't, well, now I've had some people who have read the book and they come in and they say, this is me. So that, makes my job easier.
Yeah.
And, some people will read the website and say, wow, I do this. But somebody who hasn't, they'll come in and they'll say, I'm having problems with my boyfriend. He says I'm too controlling. You know, I'm having problems with my wife because I'm a workaholic and I can't stop. That's, I'm having problems because I pick on everything so much. I'm a nervous wreck now. But what most people do is say, I don't know why I developed this panic. So you have to do the detective work. What happened? I knew someone who developed very severe panic because she wanted to leave a job she hated. And she said, I can't seem to do my resume, which to us, means she doesn't want to.
Yeah.
But
Yeah.
she, yeah, but her parents picked her career. So she was in a science, she hated it, and she really wanted to do something more in the fashion field and had a dread of disappointing them. So I saw how she suffered in the first session. Beautiful young woman,
Mm.
and just so sad. And
Mm.
she came, and I said, have you ever been disappointed or had a fear of disappointing someone? And new tears, and that was it. She was afraid to tell her parents she wanted to get out of the field, and happily everything ended well. But I'm very grateful she happened to come to me, because what she would have gotten with just a label, it would not have been good. And this was a specific thing. So they don't come with that. They come with, I'm panicked and I don't know why, I need help. And I'll ask a crazy question because I know that 9 out of 10 of them are going to have these issues. So if you hit on the right thing, I used to wait for it to emerge. And then I thought, no, it's enough with that. Let's just get to it. Let's just reach out. And that's what I wanted to do, because the suffering I've seen, they have no idea. And most of the people I've seen have had a lot of therapy, and no one listened to what happened.
Well, I came across one of the Morenas who talked about the cultural conserve, I think it was, that where sometimes as therapists we can think we put people into boxes because we want to just kind of reassure ourselves of the way of working. So we're almost like we're not we can miss really hearing if we don't pay attention that it is a unique client each time we come. And if we're so kind of caught up on making presumptions of ways of working with someone, then we might miss someone.
it's true. It's true. I agree. And I think some of our training gets in the way. I really wish in every class, because we're in school a long time, right? It's a
Yeah.
long time. I wish every class started with, first and foremost, you're a human being who's listening and trying to help. But people forget, and
Yeah.
they want to do a good job. They want the box and the treatment plan. They're kind of doing the perfectionism thing too. It's
Yeah.
and I agree with that completely, and it's a sad thing. And it also goes to the point of, these are very well-intentioned people. These are not mean people. They
They're
mean.
not they're not mean, but if we haven't if we're not okay with ourselves, then how can we truly listen? Is that because like if we're the whole time thinking um we're over and maybe over identifying, and we think we know what someone needs,
Right.
then I know as a client in seeing a therapist, I would think, hang on a sec, I haven't emptied yet, I haven't told my story, and someone would intervene and either want to maybe get somatic by saying, well, what are you feeling in your body, and I haven't even said what I was really ailing me, or they might want to just be very felt sense. But again, it was almost like a subjective intervention because I hadn't really told my story yet. So I always think, as a practitioner, we need to hear this unique individual tell their story.
I totally agree with you. And I think you need to also know what's your stuff and what's not. And unfortunately, a lot of times that doesn't happen.
Yeah,
A lot of times you know, there might be a therapist who thinks every single woman's been sexually abused.
yeah,
And then not everyone has. It's a terrible enough thing. Or might think all fathers or all mothers are manipulative. And you've got to really be very careful with that, because you can do damage.
yeah.
You can
And
damage if you don't have that separation of what's my stuff, what are my issues, and what are the client's issues. And I think if you have a doubt, but you have enough self-awareness to know and at least have a doubt, I think with the client, you could say, I don't know if this is just my thing and this seems this way to me, but this really seemed very unkind. I mean, do you agree with that? Maybe it is me. And they're like, no, I agree. I think
yeah,
so. I think having humility is a good thing. It's
yeah,
because we're people, and we've suffered, and we've had our paths, and we want to help people. We're not trying to
yeah.
be superior to anyone.
You know, whenever I get together with fellow therapists, CPD, continual professional development events or other courses, and whenever we kind of get together socially, invariably we say to each other, isn't it a crazy job we do?
Yeah, it sure is.
Because, like when you're in the kind of the kind of almost not quite on autopilot, but you're kind of in the throes of going from session to session. It's actually when you get a break from that and actually just reflect, it kind of makes me realize it is kind of, I mean, some people have said it's sort of similar to prostitution in a way. People are paying for time and they want to be heard. um what do you think, there's any kind of similarity there?
You know, I wish we were paid by the state and not the client.
Mm.
I don't think that'll ever happen here. But, you know, the truth is, we care very deeply. These are people in our lives. That's why I called it a special kind of love. I think it is. I admit that. And you know, when people get better, our goal is to get fired, you know?
Yeah.
And, you know, you watch people improve and improve and improve, and they say, remember I used to do such and such, and you go, yeah, I remember. And they say, that was stupid. It's like, well, we all do stupid things when we're hurting. And they leave. And, you know, someone said to me, so are you happy? I've really got my life together and I'm stopping. And I said, I feel very sorry for myself right now. I said, someone dear to me and my heart is walking out that door. And I know I should be jumping for joy, but there's a part of me that is not. And that's what we do,
Yeah.
because the goal is to not be needed and to not really, you're not going to be with that person. So I think it is, I think it would be like, it's sort of like prostitution if you saw someone who didn't care.
Yeah.
You know, here's money and I'm going to start crying and telling you things. But, you know, we're all different kinds of people among therapists too. We do care.
Yeah.
We care a lot. And I think, you know, back in my community mental health days, I had seen a few prostitutes, and I can tell you some of them care. Some
Yeah.
of them really feel for people. It's not a pretty thing to have that be your best chance at making a living. It's horrible. And but you know, sometimes one will say to you, I really feel bad for this guy. He just wants someone to talk to.
Yeah.
He just wants someone to talk to. So I don't really I don't really feel like that, but I think the tone would be different. I know this is kind of tangential, but I think with a mental, well, emotion, everything's emotional, but even with a physical problem, I think we would all feel more loved, certainly in the US, if we had universal. It's like, oh, I matter. I matter to my society. And the fact is, we don't.
Yes. Yeah. Yeah, absolutely. I mean, and even though we have universal here, Aleta, unfortunately, the waiting time to see a counselor, a psychotherapist on the NHS is appalling. I mean, people will wait months. Yeah.
So I guess I shouldn't completely idealize it.
Yeah. I mean, it's just got a funding crisis, and we're currently going through the whole discourse in the UK around parity of esteem, physical health with mental health. But, some extra funding is promised, but really most therapists work in private practice. And because, I mean, the other thing is working in the NHS, I mean, we are probably going off on a slight tangent, but you're going to be working under a consultant psychiatrist. You'll be working within a multidisciplinary team. Now, that might suit some people, but to be forced down an so-called evidence-based medicine route and working with CBT as in a prescribed way, I don't think would suit a lot of psychotherapists.
I think you're right. It wouldn't suit me.
Yeah.
I didn't realize it had to be that way.
Yeah. But yeah, it's a very interesting tangent. Maybe we'll have a separate discussion about it. So Aleta, if people are watching this who might think shame and perfectionism, either in themselves or a partner, they'd be probably asking, how do I access help? How do I go about maybe recovery, and what would recovery mean?
Well, this is why I wrote the book, because I thought a lot of people have written to me, which I love. I just love. They've shared their stories. You know, the book's in French, which I don't know, but I've learned to read some messages. I learned to use the online translator,
Oh, that's handy. Yeah, yeah,
but I'm extremely touched. And what they've said is that this has changed me, because it's not a cheerleader feel good book. It's a very gentle step by step guide to introspection. So with exercises, examples of other people that had similar things. You know, of course, they're all composites disguised, but that doesn't change how useful they are. They've said they love the examples, they love the exercises, and that their lives did change. That they cried, that there were things that were sad in there, but they were changing. And I think I knew there were a lot of things out there like it's okay to be imperfect. And I didn't want a thing like that. I wanted something like, how do you recover? I'm going to try to be with you even if I don't know you.
yeah,
And people have written and said, how do you know me? We never met. And you know, some of the reviews have said you can do this alone, you can do this with a therapist. So I truly think working through the steps in an ordered way that really respects what people go through. I think that's very important. I think the reason people listen to it is it's not a da 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 da. It talks about the hurting. It talks about the good intentions, and it talks about what's left when they don't quite come out right, and how they got that way, and what they're trying to do. Um, One lady called it painfully accurate, but she liked it. Um, that was a lady in the UK. But I do think introspecting in an ordered way with some good guidance and empathy and respect, it should really be very helpful.
yeah. And presumably, perfectionism and shame is omnipresent with addictions.
Yeah, I think the black and white thinking that perfectionists do is sort of like what people with addictions do. It's sort of like, well, you know, I overate today. I had a bunch of cookies, so I'll just go off and have whatever I want and really feel lousy instead of saying, yes, I went off. I'm human, but I'm going to go back to the healthy stuff now. You don't have to just keep goofing it up because you messed up. And I think like with alcohol, with drugs, I can see where that would be a thing. And also the shame. I think shame sometimes drives people to it. They just can't stand themselves.
Yeah,
They stand themselves, and it's again there's an abyss. So I think if for anxiety, depression, panic, addictions, certainly some eating disorders like anorexia, it's like perfectionism is there. I'm never good enough. I'm never thin enough. And of course, my goodness depends on how thin I am.
yeah,
And society really gives people a big push to have these issues. We forget who we really are and who we want to be with and who we like. Just want to be better, better, better. And it's, you know, being the smartest in something is not really important.
I mean, comparing is awful, isn't it? Because I mean, there's always someone who's done more or is whatever.
I value kindness and sincerity so
Yeah.
much. I meet someone like that, I'm smiling the rest of the day. I really do like it, but I do understand that in this culture there are people that have a lot of trouble distinguishing a mask from a real self, and they
Yeah.
compare their real self with a mask. And you know I always say try to figure out what's really going on. And I think nowadays, maybe you could always say this, but I feel like nowadays, in the US and so forth, black and white thinking does not make it.
Yeah.
it this is very important. There's serious stuff,
Yeah.
the black and white thinking. But it's true, if you say one thing, oh, then you think such and such. No, I don't. But they will try to put you in a box. The society will.
Yeah.
I think. I think for emotional. I wrote the book for emotional reasons. I'm a therapist. That's where my heart is. But I can see that just living in the world, that there are some political and social reasons to really not just think in black and white, and to not just want people's approval, but to really use your mind as much as you can.
Oh, for sure. And I think the more we embrace contextual issues, I mean, if you look at, well, a range of theories would help that, wouldn't it? I mean, Ken Wilber's AQAL, isn't it? The
I like him.
Yeah, I mean, just looking like so, Marxism is just as important as Freud, and just seeing the cultural kind of context in which someone has been uh, brought up and the dynamics of their socialization is just as important as the internal sort of object relations, I think.
I do too. I do too. And I think there's a point where they really come together. And I also think people that have worked on their issues that don't feel bitter,
Yeah,
that are not still needing so very much validation, I think our more natural state is to care about others and to have empathy for others.
yeah,
I think it becomes very hard when you've suffered a great deal and your world did not give you a compensatory experience.
yeah,
And then you look at someone else. No one helped me.
yeah,
It might have been a neighbor who smiled at you one day, who
yeah,
gave you strength to go on. So I do think we owe it to ourselves, we owe it to others to really try to understand and to try to deal with our own issues, to be
yeah,
able to self, to not be put in a box, and to really try to hear what others are really saying.
yeah, for sure, for sure. So, Aleta, it's been a pleasure chatting to you. I feel like there's so many other things we could talk about, and I think just ways of working specifically with this area would be a fascinating one-day conference that I would certainly attend. So, if anyone is listening who might want to access help, are you currently available, and how would they contact you?
Um, I only I can do coaching
Yeah.
outside Florida, and I do that. Um, you know, it's still me, but with the responsibility level, since I'm not there,
Okay.
it's different. So, but with people with these issues, I do Skype, and I can be found or emailed on my website. It's aletaedwards.com, no space. And you know, I'm on Facebook, and I'm starting to learn Instagram. I
Yeah.
told you, I don't like computer things, but I'm, you know, I have 2 posts, but I'm getting there. But yeah, I think my website, Facebook, and I've got the book right here. Is it okay to just for a second? Or
Yes, for sure. Yeah.
okay, and here's the book, Fear of the Abyss, Healing the Wounds of Shame and Perfectionism. That has my information on it. And you know,
Available from all good bookshops.
now see, I don't know what bookshops there have it, so I always tell people Amazon.
Yeah. Oh God, Amazon. Yeah, will be the.
You know, our bookstores, for them to carry anything, and it's published. You know, you've got, I touch your forehead to the floor, but I don't know. But oh, I will say, on my website, aletaedwards.com, you can see an excerpt of the book. You can read of this. So if someone would like to see that excerpt and see if this applies to them, they could do that.
Yeah.
And yeah, I do Skype with people, and some people just send me an email and share some things, and that's really nice too. I've honored everything that's been shared with me.
Yeah.
Certainly the
That's the wonderful side of the work we do, isn't it? It's
yes.
if we lose sight of, I guess, what an honor it is anyway to be given a trusted access to the inside of someone's psyche is an honor, isn't it?
It's a huge honor.
Mm.
It's a huge honor. I mean, that is, you know, if I didn't need to do something for a living, I would do this for nothing. But I would then have to do something else.
Yeah,
Problem. But don't you ever feel that way? Like,
for sure.
if money just showered from the sky to you, wouldn't you do this? I mean, I would.
Yeah, I remember someone actually on some therapist was interviewed and asked, God, why did you become a therapist? And their answer was, I think she said, why wouldn't I?
Oh, that's cute. That's a cute.
Yeah,
Yeah, it's hard to think of doing anything else, but it is a different kind of life.
yeah, for sure. Well, thank you for the chat, and I'm sure we'll collaborate again in the future.
Okay, great. Thank you so much for having me. It was really a pleasure.
You're very welcome, and enjoy the sunshine the rest of your day.
Okay, you do the same. Take care, Noel.
Take
Thank you.
care, Alita.
Bye bye.